this video we'll discuss about fistula. So fistula is a abnormal communication between the lumen of one viscous and the lumen of another viscous. So this is basically the internal fistula, or it can be of the hollow communication. So communication between one hollow viscous with exterior. So this is basically the exterior fistula. Now basically what I want to tell you is this is suppose the lumen, and there is a communication like this between the viscous and the lumen. So this is called as fistula. Okay, now coming on to the types, now it can be either of the acquired or the congenital type. Then it can be internal, external. In internal, remember examples like trichoesophageal fistula or colorectal fistula. In external, you can remember branchial fistula, oropharyngeal fistula, and thyroglossal fistula. Now, the congenital fistula in etiology, this basically occurs or arises from the remnants of embryonic ducts that persist without being obliterated and disappearing during embryonic development. Now the acquired ones, they can occur because of the presence of a foreign body, necrotic tissue, microbial infection, or inadequate drainage of abscess. Now this basically also covers the pathophysiology as well. Then coming on to the clinical features. In clinical features, in fistula, what we will see is there will be abnormal discharge, which will be recurrent. It can be persistent. Then there will be constitutional symptoms. Then coming on to the clinical examination, first history of patient, then the examination. Now in cases of examination, first of all location. So in case of location, if it is parotid fistula, it will be located in the parotid region. Now if there is some fistula which is occurring on the anterior two-third or the anterior border of the lower third of sternomastoid muscle, so it is branchial fistula. If it is occurring in the midline of the neck below hyoid bone, so it is thyroglossal fistula. If it is occurring in the right iliac fossa, so it will be appendicular fistula. Then we see the number, is it multiple or single. Opening, in opening basically if there is presence of granulation tissue or there is blood. Then the type of discharge, is it mucus? If it is mucus, it could be branchial fistula. Then surrounding skin is also seen. Then investigations like CBC and urine sugar, fasting blood sugar, postprandial blood sugar. Okay, then X-ray. Then very important is, and the gold standard is fistulography. Now in this what we do is we insert a radiographic dye in contrast, and it is injected from the opening, and then serial x-rays are taken. So what will happen is it will show us the track and the location of the internal opening. Now in the treatment, what we'll do is we'll do excision of the fistula. Now this is called as fistulectomy. Basically what you do is you suppose this is the fistula, you insert a catheter or a probe, sorry, you insert a probe inside it. Then this probe basically takes the devitalized, or the abnormal communication that is present between both the viscous. So like this is the part of the fistula which has been taken out. So this is basically fistulotomy. This is the probe. Okay. Then also, if there is partial removal, then there will be recurrence. Antibiotic therapy cover is also given, adequate drainage. Okay. Then in complications, what can occur is chronic discharge, which will lead to ulceration and excoriation of the skin. Very important, infection can occur, bleeding, long standing fistula if it remains, so it will lead to a malignant change. If there is AV fistula, arteriovenous fistula, it usually leads to growth disturbance. So this covers fistula in general surgery. Thanks for watching.